Assalamu alaikum. Muslims are required to physically and spiritually prepare for Ramadan. Those with long-term medical conditions should continue taking their medication. Those who are ill and elderly or have unstable medical conditions can be excused from fasting. You can also break your fast if you become ill during the day. Taking oral medication will break your fast. However, injections, iron ear drops and insulin are allowed. There are differences of opinion regarding inhalers and nasal sprays, so follow the advice of scholars that you trust. Your local community pharmacist is an expert on medication, so plan with them how to manage your medication safely in Ramadan.
Assalamu alaikum. Speak to your pharmacist or GP before you change how and when you take your medication. It can potentially put your health at risk if you stop taking your medication or make changes yourself. Pharmacies are open long hours and you do not need an appointment to come and see your pharmacist. They may find alternative formulations that your GP can prescribe, and these may fit your needs. It might be suitable to change your tablets to a slower releasing form of tablet. Alternatively, it might be suitable to change the time that you take your medications during iftar or suhoor. Patients with long-term medical conditions can continue to fast as long as their condition is stable. This includes diabetes, asthma or high blood pressure, and acute medical conditions such as chest infection or migraine. Remember, each person's health is different, so come and speak to your pharmacist or GP to make this holy month a healthy one. Assalamu alaikum and Ramadan Mubarak.